I think it's very important to have a patient advocacy track at medical conferences. And we need to know there's a difference. One is a patient day, which is really for patients to inform themselves about therapies and progress and research and all these things. And there's an advocacy track, and the target group are oncologists, the transplant doctors, the nurses, and everybody who's actually involved in taking care of patients, because they often don't understand what the core issues for patients are. They're treating patients on a day-by-day basis, but they probably don't see the underlying issues, the things you then don't tell your doctors, the difference between what the doctor thinks is important and what the patient themselves think is important. And that's why these kind of patient advocacy tracks, where patients define the program, invite speakers, and bring topics to the table that probably a scientific program committee would never select, is really, really important. And we've seen at EHA in previous years that this has developed from a single session into a full track already, where we're actually defining the program, inviting speakers, and bringing topics like adherence, cancer and sex, fertility treatment, patient involvement in clinical trials, and all these different topics to the table. And some of that will also be covered today at EBMT in the patient advocacy track.